Hello everyone, welcome. I hope you've signed into CORE. We're going to start the training now. Just give me a thumbs up if you can hear me. Oh, okay, yeah, that works too. All right, so this is the hand hygiene audit department, and it is for the department specific training. All right, some reasons that you would wash your hands: contamination, patients, when you're taking the patient's blood pressure or any contact with the patient. Assisting the patient, also direct contact again, touching the patient's gown or bed, yes, touching their property, their items that they have touched, especially in these current conditions of the virus COVID-2, and all their equipment. When your hands are visibly soiled, you're going to be using water and soap over the gel. You can gel prior to leaving the room, that's a requirement. Even though we will not be going into the rooms during this department, in the future, if you're in a room and your hands are visibly soiled, you can gel and then immediately go to the sink to wash your hands. You are going to wash your hands every time you are going to eat, after using the restroom, and when leaving a room with a patient that has confirmed or suspected C. diff. So C. diff is a microbe that does not respond to the alcohol in hand sanitizers. And as a result, it will need to be washed off with soap and water. All right, and then how to effectively wash your hands with soap and water. There are sinks in the center of the unit by the RN station, and they are you don't need to hand operate them. They have foot pedals. They're specifically placed in the center of the unit because it's easier to access immediately. It occupies a space where more rooms can immediately access them in a shorter amount of time. In addition, they usually put the quarantined or C. diff patient in the middle of the room so that they have immediate access to the sink that you can control with your hand pedals, the foot pedals. All right, so you wet your hands, you apply the soap to your palm of your hands. You're gonna be washing and rubbing your hands together for at least 20 to 25 seconds. That's the amount that you can sing the ABC song in a short or medium pace, or singing the happy birthday song twice. So you apply the palm to the palm of your hands, the soap. You're rubbing your palms together, you're interlacing fingers. Then you put your right hand over your the back of your left hand, and then reverse that. You're scrubbing. The person will wrap their right hand around their left wrist and rub around in a circle to rub the wrist, and then reverse that with the other side. You'll do the same with your thumb on one hand, wrapped with the other hand's entire hand, and reverse it for the other thumb on the other hand. You will be scrubbing, let's say, the left hand with the right hand's fingers, all the fingernails, all 5 of them, on the left hand's palm. And you'll just do circular motions. This purpose is for to eliminate or remove the debris that is stuck in the cracks of the hands, yes, but also under your nails. And then you'll reverse that with the other fingernails on the other hand. After that process is completed, you will rinse your hands and then dry them. All right, alcohol-based hand rubs. I explained this is not effective against C. diff. That's why you're going to have to wash your hands with soap and water. On the outside of the rooms, they will not tell you why they are being isolated, why it's why you need to wear certain PPE in them. There'll just be a sign indicating what level of isolation it is and what PPE is required based on that picture. You can ask the operator at the RN station if there are any C. diff patients or suspected C. diff patients. Do that, you know, close to the person, and hopefully no one's around that is not allowed to be accessing that information. The operator is going to be the person sitting with all the monitors in front of them, and they will be stationed there to watch the monitors of all the rooms that are linked up that show the heart monitors, if there's oxygen being monitored, anything that's being monitored from the room. This is the operator that will see it. And if their call light is lit up, this person will notice it and reach out to whichever RN, LVN, CNA is assigned to that room. They'll be right next to the whiteboard, which will have the patient's rooms. It will not have the patient's names. It'll have their rooms, and it'll have who is assigned to those rooms, the RN's name, and then the LVN's name, or CNA, or whoever else is assigned to that room. It'll have the doctors that are assigned to them as well, but the doctors circulate in and out. There's no set time for when they come. And your go-to for that room will be to find the operator and then find whoever they've sent you to or helped you identify, because it might be a new floor and you don't know what this nurse or what this person looks like. So with the alcohol-based drugs, you will be using these or observing. This is all for observing. I'm saying you because this is how we've trained to operate in the department. I'll remind you again at the end or during that we are not going into the rooms, and we do not have specific tasks that we are handling outside of just auditing the hand hygiene. So you'll be observing the gel when it's used, and these are the times that it should be used: entering and exiting a patient's room. Every single time someone goes into that room, they need to gel prior to going in or fully going in. Depending on where the gel is located, sometimes it's right inside the door, so it's okay for them to reach inside. Sometimes it's outside, in between two bedroom doors. Exiting the patient's room, they usually have one that's specifically for that purpose on the inside. They might have even installed more because of the virus COVID-2. So they have to gel when they leave the patient's room. And whenever they have before and after direct patient contact, this might happen outside. Let's say if a patient is going for a walk around the floor. I'm not aware of them being allowed to do that or any restrictions of them not being allowed to do that due to the current situation. In the past, they have been allowed to walk around with their walkers. So this is something that you might encounter and observe. And if one of the staff members of the hospital is there assisting, then they've already gelled and probably are wearing gloves. But if someone comes up to them, let's say the patient is by themselves, they have to gel before and after they have direct patient contact. Before any aseptic task, such as taking blood, vitals, whatever, gelling before and after. Now, vitals are usually taken in the room, so they've gelled prior to entering to the room and gloved. If they're wearing gloves and they've done this process, it's fine that they do the task that they came in there for. We will not be going in the room, so we will not be seeing this task. After potential or actual exposure to bodily fluids, again, this is something that's going to be contained to the room, so you probably and hopefully will not observe something like this in the hallway. After contact with patient surroundings, if they're being checked out, which you will not be helping them with this process either. You'll just be observing the process. If you want to follow them to the lobby, where the main lobby where they're going to be checked out, you can do so and just observe their hand hygiene after the patient has left. Before and after wearing gloves, yes, we've gone over that, and then the personal protective equipment. So tips on how to use the alcohol-based hand rub. You apply the gel to the palm of your hand and you're going to rub your hand. Similarly to the way you wash your hands with water and soap is the way that you're going to be using the hand gel. However, it's for a shorter duration of time. It's for 15 to 20, it says 25 seconds here, but it's usually 15 to 20 seconds. It could be longer depending on how much gel you have pumped into your hands. Some people overpump and it's going to take longer, and then they're left with, you know, a lot of excess gel. You will be applying or observing someone apply the gel to the palm of the hand, rubbing together, interlacing fingers, rubbing the backs of their hands with the other hand, the palm of the other hand, and then reversing that. The areas under the finger they can get by scrubbing the palm of their hand with the opposite hand finger, and then reversing that for the other side. You're supposed to do this until the alcohol dries, and in the process to thoroughly have the alcohol-based hand rub be effective, it has to be a minimum of 15 seconds. And that is the duration that it takes to sing the Happy Birthday song. Yeah, and it's easier, so you have to ensure that your hands are completely dry prior to putting on the gloves. Taking care of your hands. Repeated hand washing can cause your skin to become dry and cracked. You can get micro tears as well with excessive hot water and overly vigorous scrubbing or drying of your hands with the paper towels. The recommendation is to prevent the micro tears because this allows microorganisms to enter in through those areas. It just is a susceptibility in your skin that allows other outside factors to breach. And our skin is a protective barrier. It's one of our first line defenses. You want to keep that intact. The recommendation is to carry a traveling moisturizer because we will be sanitizing our hands as well. We should be, especially when leaving a department and entering another department. We want to also maintain our own hand hygiene while we're doing the hand hygiene audit. I recommend that you bring a travel size moisturizing lotion and you apply it. It's up to you how sensitive your skin is and what feels comfortable to you, but apply it at least like every 3 to 5 times that you've gelled or washed your hands with soap and water. Also, to keep the temperature of the water not hot and not excessively cold because that can also dry your hands, just like a tepid room temperature for the water is recommended. That will cause the least amount of drying. You pat your hands dry, being delicate with your hands are sensitive, and not excessively or vigorously drying them. All right, and so we went over some of the reasons you would be using hand hygiene. Before and putting on gloves, before and after a patient's room, going in, going out, you gel in, you gel out. Checking out a patient, so whoever's checking them out will be gelling prior to having direct contact with this patient. We'll deglove when leaving the room with the patient and gel again. They can choose to put on new gloves if they like, it's up to them. Then they will take the patient from wherever they are in the lobby. They might have to access the elevator, it might be on the first floor, wherever. They'll take them to the main lobby where our procedure is to have them checked out, or the hospital's procedure is to have them checked out through the main lobby. After the patient has left the premises and the person is returning to their department, they should hand gel. They should also wipe the wheelchair down that they have discharged the patient in. You don't have to follow them. It's not, I mean, you can join them and strike up a conversation, especially if it's an employee or the patient. You want to get patient interaction. That's great. That's highly recommended. To get to know the staff as well, just to get familiar with them, network, get connections. You're going to be eventually shifting in these departments with these employees. So it's good to have good relations and good communications with them established. You will not be allowed to do anything outside of just directly auditing and observing. If a hospital staff is to ask you if you can please discharge this patient, you're going to have to politely decline and say, I'm sorry, this is out of my scope of practice. Can I get someone else to help you with this? And for other situations as well, if they were to ask you to go into the room to answer this call out, you cannot do that for this department. You would have to remind them, I'm sorry, I apologize, I am in the hand hygiene audit department. I'm not allowed to do that. It's out of my scope of practice. Can I get someone else to help you? Anything outside of observing, we're not allowed to do. All right, that is the end of that one. I will show you what the hand hygiene surveillance form looks like. This is the hand hygiene surveillance form. It will be in the hand hygiene folder, which is in the main lobby at the receptionist desk. It will be labeled with a Coke blue piece of paper that's stapled to the manila folder. And all the documents that you need will be in there. This is one of the documents that you will take around with you as you do your duties in this department. It's the hand hygiene surveillance document. You will write your name, you will write the date, you will write the department. The departments that you're allowed to circulate in are telemetry 1, which is on the first floor, telemetry 2, which is on the second floor, the ICU, which is on the third floor, only the first half of the ICU though. The second half of the ICU is labeled CCU, which is coronary care unit or critical care unit. We're not allowed to go into that side. They put their high needs patients on that side. We're only allowed on the first side of the ICU unit. The ER waiting room, you don't even need to go into the waiting room. You can observe from the ER hallway inside on the hospital side. The only place that you would really be observing for this hand hygiene audit is the front desk. Employees, there's usually 1 or 2. You'll just observe their hand hygiene. They occasionally take people back for initial assessment to take vitals prior to taking them into the ER or admitting them. They will take them to a room that is slightly behind the receptionist desk or the ER front lobby desk. It's right in the start of the ER hallway. You can observe from the outside. However, they might close the door to keep patient privacy enforced. I would recommend just observing the front desk area, and you can also strike up a conversation with them, maintain your physical distancing while doing this, just get familiar with them, because you will eventually, when hospital fully reopens, hopefully be going through that department. It is your option at that point when you're at that level, which department you choose to circulate through, but ER is a great department. These are the labels for the people that you will be observing. P, N, A, and O. And this is the description of what those letters stand for, or what category those letters stand for of employees. You'll circle 1 for each line of whom you observed. Then you will check 1 of these, which process of the hand hygiene you observed: before contact, before procedure, after exposure, after contact, after environment. That would be leaving the patient's room, possibly leaving the room where in the ER where they've done the vital assessment, after contact with patient, before contact with patient, before a procedure, let's say vitals in the ER, that could be 1 procedure. After exposure, this can be also when a lab sample needs to be taken down. Occasionally, the lab samples will be collected by 1 person and handed outside the door to another person that's waiting. We're not allowed in any of the other departments that I mentioned. Additionally, 1 other department is 1 more. So we're not allowed into other departments to observe the hand hygiene. They will most likely be going through the lab. But you can observe the person that handed off the lab samples for the after exposure. Now you will be checking 1 in this category. Did they follow the hand hygiene process? Which process did they follow? Washing or the gelling, the alcohol-based rub? And if they did not, you check no, washing, or rubbing. Did they follow the PPE guidelines for that designated room? I believe the hospital standard guidelines right now, everyone wears a mask. Going in and out of patients, it was when we started this process, they had to gown. I believe that's still in the works. It's still a public health requirement with the hospital. But you can confirm with the operator at the RN station. The policies and everything's kind of changing. It's fluid at this moment, so based on new information that's revealed, these policies might be changing and certain requirements might be added onto or removed. Each time that we go and start a shift, no matter in what department, this is the process that you should be following. You arrive at least 5 minutes prior to your shift. You park, you check in, you go to the main lobby where you will have your temperature checked, and then you will receive a designated sticker for that day, whatever color it may be. You'll give your name, what you're doing, or what department you are going into. You will be wearing a face mask. If you didn't have one prior to entering into the main lobby, they will supply you with one. If you didn't receive a face shield prior to this, maybe this is your first shift that you're ever going to do in the hospital, you will be receiving a face shield. That is the face shield that you will have to maintain and keep with you. They're not going to be resupplying these. You can't discard it afterwards. And after your shift, it's recommended that you take alcohol wipes to wipe it down and then store it in a safe location to be brought back with you when you do your next shift in the hospital. You will be asked to keep it clean by using alcohol wipes as well. There are little tear wipes that you can use or ask them for in the front, in the main lobby, or in the individual departments. I recommend not asking in individual departments because it should be cleaned and you should be wearing it prior to entering those departments. If you absolutely need one, the main lobby is the location to get it. Right, so this is where you would put any comments. If it's comments pertaining to the hand hygiene, let's say this person was amazing, because these comments are meant for the hospital. If it's a comment that you just choose or wish to share with Co, that you would be putting in your description when you check out of core. And then I read them. There is one more document that I'm going to share with you. And this is the hand hygiene audit competency checklist. Every department has a comp checklist that you are required to complete by the 15th of the first month that we begin rotation. However, if you do not shift until after the 15th, that's fine. The date that it's due is 2 weeks after your first shift. That is when it's absolutely due. Otherwise, you'll be receiving an email from me asking why you haven't completed it. Please complete it. And there might be further action that I need to take in order to assure that you have completed this and understand. There are only 3. This is the simplest comp checklist that I believe any department has. There are only 3 categories that you, or options that you need to check off and learn for this department in the competency checklist. The first is the hand hygiene power audit point. That is what we reviewed in the beginning of this meeting. There's also a copy in the hand hygiene manila folder that's located at the lobby. The understanding of the form that we just went over and how to complete it, and how to complete only hand hygiene audits during their shift and cannot take on any other task while in the department. You'll also discuss that too. You are not allowed to do anything outside of observing hand hygiene in this hand hygiene department. Remember, if they ask you to come into the room and assist them or to check out this patient, you just politely decline and say, I'm sorry, this is out of my scope of practice. Can I get someone else to help you? If it becomes a problem where you feel that it needs to be addressed, you can always leave me a comment in your checkout when you check out a core. And you can also email me and we will go from there. You would put your trainer's name here and the trainer signature. This is where you would initial, and then the date that you completed these, the trainer's initial. You can get any department coordinator to sign off on the training. They will probably ask you and review it with you if you know these. Do not ask the RNs or anyone in the individual departments to sign off on that. That isn't their job. And you can have, usually I've seen Amber signature on here. If you cannot find a department coordinator or someone to sign off on this, just leave this sheet in there. Amber usually picks them up and will sign off on them then if she's had contact with you, or I will follow up with an email. Remember, the departments that you can observe through are telemetry 1, telemetry 2, 1 north, the ICU, only the first half, and the emergency waiting room. And that is all of the training for this department. Are there any questions?